Good. Welcome to this week's episode. I'm joined by Dr. Rachel Olivier, and we are going to be talking about sexual wellness postpartum, post birth. And this is a topic that I don't think gets a whole heck of a lot of attention, but I can remember back in the day, 19 years ago, when I gave birth for the first time. So I'm looking forward to this conversation. Welcome. Thank you so much for joining me.
Thank you very much for having me, Kim.
Maybe if we could start out by having you tell us a little bit about yourself. So, what got you interested in this topic? I know you are a nurse practitioner, you're also now a researcher. Can you tell us a little bit about what led you down this path?
Yeah, so I started my nursing career in 2016 when I graduated from the University of British Columbia in Kelowna. And since then, I've really had, an interest in both frontline clinical practice and in research. And I find it's, a profession where we can sort of have the option to bridge the two. So kind of coming out of graduation, I knew I had interest in research and further pursued that through my graduate studies at Dalhousie University. And really, I think it's something that's always been, what I've loved. I've loved having the combination or the blend. And, when I'm in clinical practice, I want the research piece. And when I'm in research, I'm thankful to have the clinical lens. So it's been, amazing being able to bridge the two in terms of my practice as a nurse practitioner and having kind of the research background as well, especially in women's health. I think it's an area where we need a lot of that. And so for me, it's just been, that much more fulfilling to be able to have that in my career.
Amazing. And so you mentioned you were at Dal, and as I understand it, you're coming back to BC, and you'll be doing more research with University of British Columbia. Is that correct?
Yes. Yeah, I'll be based at the BC Women's Hospital and working with the Women's Health Research Institute, as well as, yes, with UBC.
Okay. And so sexual wellness has been something that you have been studying as part of your graduate studies and will continue to do. So tell us a little bit about that. What led you down that route? Why did you choose to focus there, and maybe some of the things that you have been studying to date?
I started my graduate studies and knew I, had interest in women's and maternal health. And as I began kind of looking at, okay, what do I want to study? What do I want to do for my research? I, had kind of learned from my experience working. I actually volunteered in a sexual health clinic during my undergraduate degree. And so had sort of that lens there and started to think, I wonder if there's anything on, sexual health after birth. And do a bit of a search of the literature, and lo and behold, there are big gaps in that area. And so that was kind of the first step of really seeing, okay, there is something I can, meaningfully contribute here. And it was a kind of a topic that also bridged my two interests being, gynecology and women's health and the sexual health piece as well. So it was a good combination, and I had the support, of mentors and supervisors at Dalhousie and kind of going after that topic and applying a research lens that I think has benefited that area of the literature. And yeah, so it kind of started from there.
Great. And so tell us about your research. What one of the topics were? What were you studying? What did you find?
So with my doctoral research, I looked at interviewing. So I interviewed 11 postpartum individuals who were living in Nova Scotia. And so that's sort of been my primary study in this area so far, was through my doctoral work. But one thing I really noticed in the literature and kind of, okay, where could I bridge, was that a lot of the research on sexual health after birth had looked at sort of the context of couples or people who are in a relationship. And something that I wanted to know was kind of more in depth of the individual's experience. And so that was kind of something that I was very intentional with in terms of my work. But I was able to, interview several people about kind of their experiences after birth. So they were between 1 and 6 months postpartum. So I think that really added to the richness of the data as well in terms of, all these things that they were navigating. It was actively going on. It was something they were, actively experiencing rather than sort of, looking back on as being in the past. So that I think really was also very special to be able to engage with people who, really kind of were actively negotiating a lot of these things, a lot of these issues. And from that, really, really rich data, kind of came about in terms of, all the issues that people are experiencing. It's very multifaceted, as we'll talk about in a little bit. But that was really something that I think was, a great way to sort of engage with people. And now we're looking to publish it. I've, now finished my dissertation. So just now it's more about getting the word out there of these findings. So
Are you able to share, like maybe before it's published, I don't know the process, maybe you're not quite able to share what the results were or even what some of the questions were. Are you able to share any of that?
Absolutely. So in the interviews, I really kept it very open in terms of questions. I wanted it to be very much led by the participants in terms of what they wanted to bring up. So starting off with that, sexual health, it was sort of a question of, okay, how do we define that? What is or what isn't sexual health? And that was something I wanted to keep very open and have include, not only physical components, but mental, social, relational components, which is in line with the World Health Organization's current definition of sexual health as well. So with that, some of the questions I asked were really, what are your thoughts on your sexual health after birth right now? What are some of the challenges that you're facing? And it really led. People really were able to kind of bring up what they wanted, and it was more authentic, I think, in that way of just really leaving it open. So yes, in some of the answers, I think sexual activity really was foregrounded in how they defined sexual health. But for others, there was so much more. So a lot of the findings centered on a relationship between body image and sexual health after birth, identity as a mother, and how that kind of can play into it in terms of identity as a sexual person, a sexual being, and a mother. Redefining intimacy was another theme in terms of kind of how people sought that connection, and redefined kind of what that looked like in their relationship. And another finding that was really big was the 6-week check and kind of the meaning of that, and how that was really such a moment for people. It was something that I think, when people ask me what surprised you most about your findings, it was that, because it really was such a moment, and something that, I went about asking about it in kind of the question of what was a moment when you thought about your sexual health after birth, whether that was in the grocery store, in the shower, wherever it was. And every participant said, you know what? The 6-week check. So that really was a strong kind of theme in the findings. And, I think I wasn't surprised necessarily that it was, a thing, but just how significant it was, and really the meaning that surrounded that. So that was something that I think was also, neat just to see what came out from people.
Interesting. Okay, so I want to start there with the 6-week check, because I know in the line of work that I'm in with pelvic health, the 6-week check is a pivotal time, and it's historically been thought of as that's where you get your green light to have sex again, go back to fitness, go back to regular activities. And I have felt that it's maybe a little bit misguided, or I mean, and I'm thinking specific to pelvic health, and I know sexual wellness and sexual health is a component of that. But when I think about pelvic floor recovery, which will play a role potentially in the body image stuff that we're going to talk about, and the capacity to have insertive sex and pleasure and what have you. Mm-hmm. I feel like there's not enough information provided. So I think people go there thinking, am I going to get the green light or not? And then they think that the green light means just, okay, just everything's on the table again. So what was the importance of the 6-week check? Was it the green light that, okay, now it's quote unquote safe to have maybe insertive sex or sexual activity in our relationship? What was the significance that they talked about?
So yeah, absolutely. As you said, it was something that was important to them, I think, to kind of get, that green light or that green check from their healthcare provider, about, okay, this is safe to resume sexual activity if we want to. But really the meaning it held for people was sort of a bit of a dual meaning, because I think for some, it had that feeling of kind of, okay, this is a bit of a return to normalcy. It felt like more of a milestone where it's like, okay, we're at 6 weeks, we're getting, just back to kind of the normal, whatever that is for life and one's sexual relationship as well. And I think for others, it really felt like more of a deadline, where it felt like it was too soon. It felt like a very arbitrary time for sort of, am I supposed to be feeling ready? What if I'm not? Is something wrong with me? All those sorts of questions, because it really is kind of constructed as a time where, again, it's sort of this expectation, both socially and sometimes I think perceived medically, to be a time when people are supposed to feel ready, which we know is not true. It's so individual. But really, I remember talking to a few participants who really kind of felt sort of a sense of dread in a way of that 6-week check of, okay, what are they going to say? Please, I need more time. I feel like I need more time. So it also kind of brought up another issue of, okay, getting the green light, being kind of safe and everything's looking healthy and recovering well, but then also kind of bringing that back to, okay, what does this mean for me? Because I'm not feeling ready. And, as much as a healthcare provider can, judge physical healing or things like that, issues like emotional readiness, like pain, those are subjective, right? So it's something that, again, is up to the individual. But it was also kind of difficult, I think, for some to kind of say, okay, the healthcare provider says this, I'm feeling this way, and having that conversation with their partners, and kind of, again, just trying to keep it open and still, go along with kind of what they were feeling. And that's kind of where that theme of trust your gut came up a little bit in my research of, okay, I'm getting this information. I'm, cleared from, the nurse practitioner or the physician or whoever it was, the midwife. But it was something that, again, had multiple components. So the 6-week check, I think, kind of really brought all of those things together. And it was interesting to see how people navigated that. But yeah, the definition could kind of, it could be that positive, that negative. It could alternate in terms of how people perceive that time.
Yeah, that's so interesting because I think that exactly as you said, there's some people that look at it as they're waiting for that to get confirmation that everything's okay, and then even though they may feel okay, they want the clearance from their care provider. Whereas
Mm-hmm.
other people are looking at that thinking, I feel like I should be feeling better than I am, and I'm not. And does that mean that I'm failing, or does that mean that something's wrong? And so there's that piece of the dread in there as well. So I think that I don't know, there maybe in the future if we can have a different presentation of what that 6-week check is supposed to be or mean, and rather than the interpretation of it supposed to mean this all clear and everything should be fine by then, because that it hopefully could alleviate some of the pressure for people. But yeah, that's interesting. So some of the other things that I know that you have talked about and factored in. So let's go down the path of body image. And there's, so I don't want to put words into your mouth. We'll hear what you say, but part of that body image, at least with regards to what the field that I'm in, is the pelvic floor, the vulva, the vagina. And so some people think of body image as the weight gain, or I don't feel like it's my body. My breasts are bigger and I'm leaking milk, and all these types of things. But body image can also be the way that you feel. And if your pelvic floor isn't feeling great, or you feel like there's been some sort of change to the appearance of your external genitalia, there's the concern there. Was that brought up by any people in the discussion of body image?
It was, yeah. And it was something, as you said, I think a lot of people really felt that, yeah, they didn't recognize their bodies. There was sort of this connection that had changed of, okay, yeah, my body looks very different now. And what does that mean for me? And in terms of kind of the pelvic floor, again, we talk about changes, breast changes, abdominal changes, things like that. But really, pelvic floor was a definitely piece of that, of kind of that comfort and familiarity piece coming in where, okay, things are changed. And there was also kind of a bit of a fear of, okay, what is this going to feel like? Fear of pain were some things that, participants talked about in my research. And so kind of one thing that people used to navigate that, interestingly, was just sort of self-exploration, masturbation of, okay, this is a comfortable way for me to explore sensations, explore how things are feeling down there. So it's interesting to see how really people, did kind of take agency or show agency in that way, of kind of, re-exploring their bodies and just kind of what that felt or looked like, even, before necessarily involving their partners. But really it is, it's something that, I think is really connected to our, our sense of self, our sexual identity. And it really changes, not only in terms of the appearance of, our bodies postpartum, but also the function of our bodies postpartum. So again, that's kind of where a big example of, the breast changes and breastfeeding comes into play, as well. But yeah, certainly the pelvic floor was kind of a component that people did also include in that body image change and what was
Mm-hmm.
important to them.
Mm-hmm. Yeah, I think the conversation around pelvic health is definitely increasing. So there's more
Mm-hmm.
people who even are familiar with that term or understand the importance of pelvic floor exercise. A lot of people now have pelvic floor physical therapists as part of their kind of birth and recovery team, if you want to call it that. And so I'm glad to hear that was brought up. Not, I think maybe it probably has always been there, but maybe people now have words or terminology to describe that
Yes.
part of their body rather
Yeah.
than down there, or it's taboo and we don't talk about what's happened. And,
Mm.
it's much more of an open conversation, at least from my point of view. Can you talk a little bit about the breastfeeding piece as well? And this is like, I remember I gave birth just over 19 years ago for the first time. And I remember we were joking about how big my breasts were. Like overnight when your milk comes in, they were ginormous. And I normally don't have big breasts. So for some people, some partners, so I have a male partner, my husband, he was quite excited about that. but they're very painful and sore. And so there's a sexuality component to this voluptuousness that I had, but I didn't want any sort of sexual activity that would involve my breast, if that makes sense.
Yes.
So I'm curious to understand and hear what people talked about and how breastfeeding influences sexual wellness from a postpartum perspective.
Certainly. And yeah, as you're saying, there's several components to that. And I think a lot of the participants echoed, I think what your experience was as well. In terms of kind of these changes, but sort of again, the meaning of the breast, how was that meaningful to people? And for a lot, I think it was sort of like, okay, I'm using my breast in a different way now, to feed and nurture my baby and have that connection. And for some, they said, right now it feels like my breasts are for my baby, not for my partner, kind of thing. So there was again that active negotiation of this different use and different function of the body. And I think for a lot of people, again, with some of the physical symptoms like feeling heavy, the swelling, they can be sore at times, nipple dryness, nipple soreness, all those sorts of things as well. But also kind of, I think for some feeling touched out a little bit where there is so much contact and, that's, it's something you're feeding it, every couple hours with baby. So also kind of something where it was actually very nice for a lot of participants to just have physical space and not have anyone touching them when it was not needed. So with that, and then it's kind of with breastfeeding, we also talk about the hormonal components as well. So, there's prolactin, oxytocin, and sort of the main culprits in terms of changes are estrogen and progesterone. And that also can cause quite a bit of vaginal dryness for most folks as well. So that was something that came up in my research of actually some second time parents where they said, this time I kind of knew what I needed in terms of, asking for a vaginal moisturizer or an estrogen cream to be prescribed to sort of help with some of those symptoms. But again, kind of, we don't necessarily talk about this all that much. So a lot of people kind of said, it was nice to kind of go in and know a bit more what I needed. And, navigating some of the physical symptoms associated with the breastfeeding was also something that people brought up in my research. And, again, even talking about, say the milk ejection reflex when, someone is aroused or climaxing, again, doesn't happen as often, but it's something that happens, right? So all these taboos, all these things that kind of happen, and if people are experiencing them, it's sort of like, okay, is something wrong with me? Am I normal? So for me, it's about, getting these out here saying, yes, it's normal. It can happen. But there's also been people who have written blogs or have talked about experiences of arousal during breastfeeding and during that suckling, again, because of those hormonal responses that are happening in the body, the oxytocin, that cuddle hormone that we talk about. So again, these things are normal. There's nothing wrong with you. So that's also something that I think is important to kind of discuss with breastfeeding, and again, all those changes that are sometimes unexpected. So
Yeah, I think I knew that you read about it. People, your midwives tell you. I was prepared that there would be some, but I wasn't quite prepared as to how big they got and how painful it was. And now, so 19 years later, of course, I'm very much open with what I share about my body, and sometimes people think it's TMI, but now I almost have a hangover from that tenderness that was created from breastfeeding, where that initial latch and painful and like, oh, like it's not as pleasurable for me as it was prior to breastfeeding. That's my personal story. I'm not saying that that's going to be the same for everybody, but it'll be interesting to, if your studies take you kind of looking at people in the next phase of life, and what, if there has been a quote unquote hangover from some of the changes postpartum, and how they navigate that from a sexual wellness perspective. But Okay. Uh, Kind of on the topic back to when we were talking about the changes to the body. For some, not it thankfully not common, but it can happen. There can be potential birth injuries. There could potentially be trauma associated with their birth. So did those topics come up as part of your study?
Definitely. Yeah. And it's something that we've seen a little bit more in the literature in terms of looking at physical and perineal trauma, and how that affects sexual outcomes after birth, as well as kind of comparing vaginal versus cesarean sections in terms of outcomes. So it is mixed across the literature. We know that physical trauma does negatively impact sexual health after birth, sort of with more, especially more severe grades of tearing. And so, yeah, something was, I think for a lot of people, um, again, as I said, knowing when to kind of seek out resources or how to seek help if they had concerns around that. But also, again, that conversation of pelvic floor, when my grandma gave birth, when my mom gave birth, that, was not really a thing. So my research really kind of uncovered how there is this, more social conversation. There's that social discourse emerging of pelvic floor health as being something important to sexual health after birth. And we're seeing people, even in pregnancy, seeking pelvic floor physiotherapy prior to delivery and after birth, and again, really having kind of that ownership over, yes, this is an important component of my sexual health, which I think is fantastic. Um, in terms of the participants that I interviewed, there were several who experienced third degree tearing. And that's kind of where, again, as you mentioned, I'm glad you brought it up. I think we really could go further with this research of, I did interview a few people at around the 6-month mark postpartum who had, some injury to the perineum and we're still very much experiencing issues. So I think going further to, that 1 year mark, even further would really, I think yield some very rich data. And yeah, for some people, again, they had experienced quite a bit of trauma. So it was also navigating, any talk of pelvic floor physiotherapy for the people who did seek it, they really found it so positive because it allowed them, I think, to really understand what was going on with their body, have that individual feedback, that individual assessment, and also kind of that coaching where I think there was I remember one kind of talking about, she said, I at times I feel hopeless, not only because, I'm not able to have sexual activity, or things are very painful, but, for her, it was crossing her mind of, I also want to have more kids. And this is really an issue right now. So what is this going to look like long term? It was definitely, it was a stressful experience, I think, for those who had experience that during delivery. So again, it's no surprise, I think, to anyone who's delivered a baby that these things do impact sexual health. But really, I think we could kind of go into the research a lot more of, okay, yeah, how do people really experience that over, the longer term? How does meaning of the pelvic floor change? How do people see it? All those sorts of things. So yes, absolutely.
And what do you hope to do? So you're fairly new into your research career and into the research, and you've already highlighted that there's a void and there's lots of opportunity for other research to happen. What do you want to do with your data? So what is your hope that the more and more you research, would this hopefully maybe create different guidelines, maybe more awareness of pelvic floor physiotherapy, better understanding of return to sex, and that it doesn't have to be a 6-week mark, so to speak? Or what are you hoping to do?
Yeah, I think again there are so many possibilities, and it's nice, having the clinical lens as well. So one thing that we've kind of started was creating the first patient educational tool on sexual health after birth to be used on postpartum units, in midwifery clinics, in public health offices. So that's something that's been rolled out over a few provinces in Atlantic Canada so far. So really kind of, again, bridging that information gap. I think that's something that I see as a huge piece where we can come in, as healthcare providers, you and I both have that lens, of being able to offer that support and offer that information. Because I think, when you're a new parent and you're navigating so much, there's so many changes, and we all know the Google rabbit hole is sometimes very scary. So having, reliable resources to kind of go on, and if people are needing, extra assistance or follow up, knowing how to access that as well. So information for me is a big piece. And I think we really have an opportunity where, again, as a nurse, I know that that's how we do, discharge teaching on those units. So I made kind of just a little one pager, simple, but as a way of not only having kind of a resource for information, but also a way of kind of bringing up the conversation, either with, their nurse or their midwife or the obstetrician. It's kind of a nice medium to sort of, again, just bring it up, simply bring it up, I think even is so powerful. So having that rolled out, getting the education out there, having these conversations during the prenatal period as well. And yes, certainly, I think my research has certainly, a position in informing policy, informing, what's available in terms of resources. Again, pelvic floor physio was something that the participants in my study felt was so positive. But we also know it's an issue in terms of accessibility because it's not covered. So people are paying out of pocket if they don't have private insurance. So even things like that, we see other countries where it is publicly funded. I think that's an important, certainly, thing to add because we know that influences outcomes far beyond the postpartum period in terms of, gynecological health and preventing prolapse and all those sorts of things, right? So I see that trend throughout my career as well, having worked in gynecology as a registered nurse as well. So I think there is a lot of space for this, certainly in a variety of ways, including public conversations on podcasts or whatever it is. It's also important just to talk about it, get the research out there, and normalize some of those conversations, because I think the more that we have people share their different experiences, the more we normalize different experiences, rather than say a one size fits all with the 6-week check, which we know is not helpful to most people, right? So that I think is also important in terms of conversation.
Yeah. I have a sincere hope that at some point during my lifetime, we have pelvic floor physiotherapy covered by our governments. I mean, so I'm in Canada. Obviously, I hope within Canada, but really at the end of the day, I hope it becomes a global standard of care. I just, the mental health savings, the bottom line financial cost savings to both governments and persons' individual pocketbooks with, not having to buy pads and what have you. I just feel like there's so much opportunity there to save sexual wellness, to save mental health, to save a person's physical exercise capacity if we could remove the barriers of pelvic floor physiotherapy and make it more accessible. So I really hope that your research and others will move that needle forward, because it just I think it would change the world.
Absolutely.
Yeah.
I second that.
Yeah. One more topic I want to talk about before we go is contraception. So that's another big component, obviously. So you said, there's some people in there that maybe have had some negative experiences, but they're thinking, I want to have another baby. And then there's other people that are maybe they've had a negative or positive, but they're thinking, I don't want to have another baby, or at least not anytime soon. So what sort of tips do you have from a contraception topic? So what was in your studies, what was coming up as what people were using or thinking about, and what are your recommendations for contraception in the early, like how soon should they start, and what are the forms that they should be considering?
Yeah, so it's definitely something I get questions about, and one thing that actually is usually covered at the 6-week check. So it's good that, again, if sexual health does come up at all at that 6-week check, it's usually about contraception. So there are certainly, many methods, and it's an individual choice of, what's best for you and your health in partnership with your healthcare provider. But, certainly non-hormonal methods are safe. So things like the copper IUD. Also progesterone-only methods we know are safe during the postpartum period. So, I always say there is possibility of becoming pregnant anytime after birth, even if someone is still passing lochia or still having that bleeding. It is important to have some method of contraception. So whether that's use of, male condoms kind of for a little bit or whatever is best. So some progesterone-only options include, what's commonly deemed the mini pill, so the progesterone-only pill, as well as the arm implant, so Nexplanon, and progesterone-only IUDs like Mirena. So those are all options for people postpartum generally that are safe for most people. And yeah, so it's kind of, again, a conversation in terms of, timing for people. We also hear a lot about kind of what's called the lactational amenorrhea method that people use if they're breastfeeding and doing so regularly. So there are guidelines as well from the Society of Obstetricians and Gynecologists of Canada. So it is required if people are using that. Again, it's not necessarily the most reliable form of contraception, but people do, talk about it. but important to have very regular breastfeeding for that one to be effective. So again, usually that one we have just a conversation with the patient about, what their beliefs are, what's best for them in terms of, risk tolerance and things like that. So no, it's something that definitely comes up, and there are a lot of options, which is nice. And kind of again seeing what's needed in that medium postpartum period, and then perhaps longer. So generally, I find this is something that healthcare providers will touch on, which again is also important. So.
I just thought of a question. I've actually never thought about this before. How soon postpartum could somebody have an IUD implanted? So I could make an assumption that after the 6-week check, it could happen, but maybe that's not true. When can that happen?
That can happen at the 6-week mark. And actually we see some examples where people actually immediately postpartum, so immediately after delivery, have an IUD inserted if they know something that they want. So it is a possibility. There is some level of higher risk if that is done. So there's an increased risk of uterine perforation, as well as expulsion of the IUD, because the uterus, the cervix, everything is still going back down to size. It takes about 6 weeks for all that to go back down to pre-pregnancy size. So it is possible to have an IUD inserted actually immediately after birth. But again, we usually have kind of a conversation because there are some risk associated with that. So kind of, again, it's kind of what's best for the patient. Usually we're kind of, if it's not done immediately after birth, typically we're having that conversation at the 6-week mark. And it is absolutely safe to have an IUD inserted at that 6-week check if it's something people want.
Wow. I had no idea you could do it immediately. That's interesting.
Yeah.
Yeah. Very cool.
Yeah.
Thank you so much for your work and for sharing your knowledge. Where can people learn more about some of the work that you have done, the work that you will be doing? Do you have a website or a location that you would direct people to?
I have a ResearchGate profile, which is generally where most of our publications are out. So again, that's sort of the research piece. But my profile on ResearchGate is something that people can look into if they're wanting to look at the literature that I've been involved with, other maternal health research more generally. And otherwise, I am on social media, on Twitter, for anyone who's wanting to connect there. Kind of as things come up, as projects come up, I'll usually share, be sharing those features or things like that. So, yeah.
Amazing. And I will post the links to those in the show notes. So thank you so much for spending half an hour with me and sharing all this amazing knowledge.
Thank you very much for having me, Kim.